I'm going to talk about the lab time. We call it the academic development time here at Michigan. And I think one of the things that makes Michigan different than most other programs is we take our academic development time very, very seriously. There's an expectation that you come here, we'll train you how to take care of really sick patients, but we'll expect that you do more than that. We'll expect that you think beyond just one patient at a time, and you think about foundational problems relevant to health and wellness and specific to surgery. And we guarantee you that we will put you in a position to impact those problems, develop into a future leader in academic surgery, and provide you with the foundational skills you need to do those things. And that's kind of our essentially part of what we call the Michigan promise. So two of us, Dr. Sandu and myself, have this kind of assignment to steward this process for all of our trainees. And really our job is to make sure that you achieve academically, you have the mentorship you need, and you do all this within a community that really facilitates your flourishing in all aspects of professional development. And really, it's a great place. I think the biggest challenge we have with the academic development of our trainees is that there are too many opportunities. So based on feedback from some of the residents, we've added some structure. And I'm going to talk about that structure briefly of what the kind of the lab time, so to speak, is like at Michigan. So you basically do 3 years of clinical training, and then in your fourth and fifth year, you do what we call one of these majors. So basic science is done at the Center for Basic and Translational Science. Health services research is done at the Center for Healthcare Policy, Outcomes and Policy, and surgery education research is done at the Center for Surgical Training and Research. And these are large centers within the Department of Surgery, and they essentially exist to facilitate community among scientists and to facilitate opportunities for trainees. And these are created essentially for the trainees to make sure they have what they need. And you pick one of these and you kind of hop into this community. In addition to kind of a major, we also offer four other centers that we kind of consider minor. So for some folks, this may be the primary focus of what they do during the lab time. But this is kind of a little bit of a path less traveled in academics, but equally important. And we want to make sure there's structure here. And you can kind of do a basic science, but also kind of spend part of your time doing a minor in healthcare administration. So I'll talk about these quickly. One is in in innovation entrepreneurship. The other one is in global surgery, where you not just serve and do global surgery, but really focus on how to do research in global surgery. Healthcare administration, I think more and more surgeons are called upon to run the large business that is healthcare delivery. A lot of the faculty within our department do this, and we have a specific pathway to teach you how to get some of the core skills to do that in the future. Then finally, health and design. One of our trainees who just finished last year is an architect and has a real interest in design. He writes grants on how do you kind of design hospitals and ORs that most efficiently and effectively do patient care. And it's an exciting, very innovative approach to kind of academic medicine. So during the lab time, we guarantee funding for every trainee. We have a series of ways we do that. One is we have a portfolio of NIH-funded T32 training grants. In our department, these are the ones that are listed. There's also other ones that we are kind of co-investigators within other departments. And then we're a primary site for the National Clinician Scholars Program, there's a couple sites across the country where we are one of them. And we take a national cohort of scholars, but many of our surgical trainees decide to participate. In fact, Val is on the call. She is one. And if you have any questions, I'm sure Val could tell you about that. It's an extremely prestigious program and really gives you a lot of the foundational skills to kind of affect policy change in healthcare delivery. So I think one important point is our lab time, once again, we take it very seriously. But that structure can get in the way of some residents. Some residents really have different skills, they have different passions, and we are here to support all of those. So we are right in the middle of the University of Michigan campus, and it's one of the largest universities, as you know, in the world. And we encourage our trainees to take advantage of all of those resources. So one trainee was going to go to Cambridge. COVID messed that up for his first year in the lab because he's kind of already ready for tenure. And we wanted to really challenge him and to see kind of healthcare delivery in the National Health Service and do some implementation science research. Another trainee spent time in Washington, D.C. as a White House fellow, doing kind of a practical healthcare policy on a national level during one of his 2 years in the lab. And we will we will support and fund that time in the lab for you if that's kind of what is in your best interest. Finally, we have a very, very deep bench of surgeon scientists that are here. I think there's no shortage of faculty to work with for sure when you do your research time. In white, we have faculty who are kind of full-time scientists. In yellow, we have faculty who are clinically active surgeons who have federal funding in research. And you can see this list here, and it's 2 pages long. So you can work with any of these individuals or many other individuals who have different types of funding to fulfill your ambitions on how you want to develop as an academic surgeon. So we have specific structure around this, and I won't go through this in detail other than the fact that this process, the academic development time, really starts before you arrive at Michigan. So when you come to interview, be prepared to talk about the problems in healthcare and in surgery that make you kind of crazy and how you want to think about trying to fix some of them. Now, we will provide you, we don't expect you to have a specific plan, but you need to have a very mature explanation of things that are broken in the healthcare delivery system. And they could be foundational scientific, or they could be policy delivery, or anything in between. That is what we look for in our trainees. And all of our trainees in our program come in with an expectation that they're going to do foundational improvements on healthcare.